Everybody, hi, this is Dr. J. Mawhinney. I'm putting on my Dr. J hat today, and I kind of want to talk about veterinary specialties. The As in human medicine, there's a huge number of specialty people in College of Veterinary Surgeons, College of Ophthalmology, College of Veterinary Dentistry, College of Internal Medicine, and College of Veterinary Practitioners, which of course is a very, very skilled day practice person who has taken it up to another level. Now, the one thing that is a little discouraging is some veterinarians actually are a little afraid of referring these difficult cases to these specialists, and honestly, they are an extension of the day practitioner's know-how and ability to practice. As a small animal practitioner, when I had my own practice, I used my specialists a huge amount, whether it was a critical care specialist or an internist, or especially veterinary surgery for major orthopedics procedures, spinal disc procedures. Neurologists are so much better prepared to be able to work up a very, very difficult unresponding seizure case or other neuropathies that are going on. It's so important, and some veterinarians are afraid they're going to look bad, I think, and so they don't, and they hang on to their cases too long, and many times mismanage them accidentally, not on purpose. It's really important, if things are going on and tests have been done and redone and nothing's happening, things aren't getting better. As a client, you have the right to ask, do you think, doctor, that this needs the eyes of a specialist, a third eye? The thing about it is there's several tiers of medical workup available when we're trying to diagnose and treat a particular case. And the first level is everybody can do, and that's the blood work and urinalysis that you send to the lab, and x-rays, and if things aren't showing up and you think that there's something a little suspicious but you're not sure, the veterinarian can always send the films to a specialist, a radiologist, and have an expert reading on it. And many times things that they see, we who are generalists might miss. And so it just takes it up to that next level. Now, if nothing's happening, things aren't improving, and with all of the diagnostics and treatment regimen that things are going, and there's been a real good effort, the next step is to get ultrasound, for instance. Now, a lot of practitioners have ultrasound, but these aren't specialists. And if you're talking about needing intestinal and liver biopsies and pancreatic biopsies and things like this, and a good, accurate read of the cell content of the kidneys and spleen or liver and things like this, the practitioner might be pretty good at it, but there's a point where you really do need expert eyes, a radiologist or an internist who is really, really good at doing ultrasound. Endoscopy is another second level diagnostic procedure, and even if a day practitioner has that, sometimes things can get missed, especially if you're looking for subtle little tumors and ulcers and things in the stomach or upper intestinal tract or in the colon, or when is the time to get in a biopsy and what tissue you should do, and how to prepare the bowels properly. You don't just go in and do it. It's to get a good diagnostic endoscopy, it's best to have a 24-hour fast and, of course, full sedation, and have that area diagnostically ready for observation. Same thing for people. That's why they have you fast for 24 hours and have you do purgatives and all sorts of things to clean out your colon when you're doing colonoscopy. It's just the way it is. We're in the summer is coming on, and all these summer allergies are going to be causing nasty, nasty problems with dogs and cats. And I'll tell you, it's not right to just have your dog live on prednisolone or some other cortisone, or getting cortisone injections and things like this to mask the symptoms of what's going on. Sometimes that's the end result, but if it's a flea allergy and flea control's not totally taking care of it, well, maybe it's something else going on. Maybe there's food allergies, and sure, the day practitioner get them on a food test, but many times you need the eyes of a dermatologist to see if there's something specific, or if they need allergy shots, and getting allergy testing for specific allergens where you can actually block the immune response. In the 50s, long before I was in school, and when cortisones were first found, they were considered a miracle drug. They know now that long-term cortisone therapy is horrible. It wipes out the adrenal glands, it's hard on the liver, it's hard on the kidneys, it increases fluid retention, it drops your resistance, so you're more likely to get viruses or fungal infections or bacterial infections. That's not a cure-all. And I hate to see these cases that have been on prednisolone for 3, 4, or 5 years sometimes, and it's a mess. It's a mess, and most of them have secondary bacterial infections by the time you see them, if they're in that situation. And no, really, if things aren't getting better, ask for a referral. It's your right. And the specialists are specifically trained, whether it's oncology, which is the study of cancer treatment, or neurology, or cardiology, the specific treatments for heart problems. There's many, many times they can give very successful treatment, or at least come to a conclusion where you end up spending more money not going to an internist or some other specialist when there's a difficult problem, and coming out with a bad result because of the fact that things are lingering and treatment is prolonged. Sometimes it's prolonged on something that there is no future and that you can't fix, or that it's fixable, and by the time they get to the internist or other specialists, it's too late. So do think about that. You all have a good day, and love your pet, because all they ask for is some food, a good environment, and a lot of love, and that's all, and they give nothing but love back. Have a good day.